Hi guys. So we recently paid a visit to periodontist, that is children's dentist, for our toddler's dental checkup. The idea of cavity and tooth extraction for a small kid scares me to no end. And it is a fact that there are so many children nowadays with cavity issues. The thing is that it is totally preventable if you maintain good oral hygiene. Talking about myself, even when I tried to be so diligent about my son's oral hygiene, we ended up making mistakes. So I thought I would discuss with you today how we went about oral care for our son's teeth and also the mistakes that we made, in case it helps anyone from not making the same mistakes that we did. So once our son turned 6 months old and started solid food, we always tried and gave him some water after meals to clear his mouth, because at that age babies don't really know how to rinse and spit. Once they sprout teeth, you're supposed to use a brush and a toothpaste to brush their teeth twice a day. As soon as he sprouted teeth, we got him a finger brush and baby toothpaste. I got him Jack and Jill toothpaste. It's supposed to be really good, and we tried a couple of flavors, but our son did not care much for it. So we shifted to Dr. Brown's toothpaste. Both of these were fluoride free and natural and wouldn't harm the baby if it was swallowed. For me, it was difficult to clean such a small mouth and such tiny teeth. Plus, it was not easy with a wriggly baby who hated it. But as he grew older and we shifted to a baby brush from a finger brush, oh my god, it was the hardest thing in the world to brush my 1 year old at the time. It was such a struggle, so I started using my finger to brush his teeth and skipped the toothpaste to make the brushing process doable. My son was happy with the arrangement, and I thought as long as he's letting me clean his teeth, we are good. But then gradually we saw some white lines on his beautiful pearly white two front teeth. Those were the teeth which he sprouted first. Something obviously was not right, so we consulted a periodontist. Turned out it was a mild case of caries. It was just starting, and doctor gave us a cream to be applied on his teeth to stop the spread of caries temporarily. She also told us that fingers do not make good brushes, they just do not work, and you got to use a toothpaste. So basically, it was our job to make our son understand instead of skimping on the proper brushing routine just because it became difficult. Until 2 years, you're supposed to use a manual toothbrush and fluoride free toothpaste. We got couple of brushes, some were too hard. We ended up using Chico brush. Its bristles were soft and our son could grip it well. We would brush our son's teeth and then let our son brush himself for a bit. We explained to him why it was so necessary, showed him the teeth which had marks on them. It always made him sit still for brushing. We also started brushing our own teeth around him to show him that we brushed our teeth as well. He loved the sound of our electric toothbrushes, so we promised to get him one once he grew older. Some songs on YouTube, like Elmo Brush Your Teeth song and Blippi's toothbrushing song, help in getting him to brush as well. He still doesn't look forward to brushing, but it has become a habit. And even when he sometimes tries for an initial bit to escape, he does end up cooperating. Now that he's almost 3, and because I wanted his front teeth to be more thoroughly cleaned, I really do not want the caries to spread. So we got him an electric toothbrush from Oral-B. Now he knows how to spit and does not swallow anymore. So we have recently shifted to a fluoride toothpaste. Right now we are using Patanjali toothpaste for kids. It is also super important to make them rinse their mouth after munching on anything during the day. This is the step we also sometimes used to skip before, but it is so important. I hope you liked the video and found it helpful. Please do like and subscribe if you did. I will see you in my next one. Bye.